accessing the services that keep us safe. Access to sexual and reproductive health services in privacy and in confidence should be the right of all young people. But in many nations, parental consent is needed. Even if adolescents have legal rights to access services, they can be turned away by a provider with negative attitudes towards sexually active young people. This creates barriers to access and discourages young people from seeking essential help and advice.
I have been dating my boyfriend Mark since we were 15. We are now 17 and have started sleeping together. We used condoms, but last month one broke, and we were scared. In the end, I wasn't pregnant, but knew we had to be more careful. I wanted to take contraceptive pills. I had read online that the law says girls my age can get the pill without anyone knowing. But in the local clinic, the nurse said she was sorry, but she could not give me the pills. I was too young and so needed consent from my mother. I tried to show her the information I had on my phone, but she said it wasn't official and got angry. I was afraid people would overhear, so I left the clinic. I know the information online was correct, but I cannot afford to go to the clinic in a bigger town, and I am not asking my mom for permission. It's not fair. The law says we can get the pill anonymously. But in our hometown, this isn't happening, and everyone will know and judge.
Girls like Giap have the right to access sexual and reproductive services and counseling in privacy and in confidence. They shouldn't be made to feel afraid or ashamed. What must be done? Young people's rights to sexual and reproductive health should be enshrined in law, without requirements for parental consent or age restrictions. We need to introduce the legal presumption that adolescents are competent to seek and have access to preventive or time-sensitive SRH commodities and services. Health workers also need policy support, so they know the latest laws when providing SRH services to young people. Young people have a need to be heard and a right to be listened to. It's their future, after all.